What's your name?
Linda Strickland.
And how old are you?
53.
And what are the diseases that you have that class you as a disabled American?
Rheumatoid arthritis is my disabling disease through the federal government.
Do you have any other diagnosis?
Yes, I do. Fibromyalgia and recently type 2 diabetes.
And in your opinion, which one is more debilitating?
The fibromyalgia.
And why is that?
Because it disables you in, physically and mentally and frankly at times spiritually it's horribly debilitating.
And what does the fibromyalgia, how does that affect your life?
Well, it's not as recognized as a disease, quote unquote, by many experts or specialists. So when you try to seek help for it, you feel, unrecognized, unappreciated. It is very disrespected in terms of what you feel versus what you're being treated for.
Would you class this as a hidden disease?
For me, it's a hidden disease.
And why do you say for you? Is it, how many people that you know of with fibromyalgia, how many people can you honestly look at and tell that they have it?
You can't tell that anyone has it. I do from from outside. I have a network of friends that I have fibromyalgia, and they all feel similarly, if not identical to me, because of that very thing. From the outside, looking at me or them, we look healthy.
Now, what about your rheumatoid arthritis? Can you look at you and tell that you have that?
You can look at blood work, x-rays, some of my fingers and toes and joints are starting to deform. If you were to look closely, you could identify it.
And what type of treatments do they have for your disabilities?
For my disability, my legal disability of rheumatoid arthritis, I'm injecting Envol after almost 10 years of elevating to that drug, going through everything from physical therapy to Plaquenil to methotrexate, and now I've been on Envol for about 6 years, which I injected in my legs twice a week. And narcotics. And antidepressants.
Antidepressants,
Antidepressants that are more specific to the depression caused by pain than anything else.
How do you find yourself living as a disabled American?
In an isolated state, except for family. I don't socialize much. I can't obligate myself to Tuesdays at 6 or this or that, or Saturdays at 4. Because I know how I'm going to feel Tuesday at 6. And I don't really want to be around noise. Noise causes pain when you have fibromyalgia. Stress causes pain.
If you have any advice to give anybody, what would it be?
I've said this many, many times. Don't judge somebody's pain. Never compare their pain to what you have felt for pain or what you've seen somebody else go for. You cannot consciously evaluate someone's pain as less than someone else's. Disrespectful. It's cruel and disrespectful to disregard someone's pain or to think that you can decide how they should, you know, accept their own level of pain or what they can tolerate. That's ignorant. People are uneducated and unwilling to realize that you can't live in another person's body or tolerate their level of pain because you don't know what it is.
Okay.
Especially if you can't see it on an x-ray or on a blood test.
But it's definitely there.
Definitely there.